Hello, my name is Jabi, and I majored in biology at the School of Arts and Science. The university as a whole, it spelled out opportunities for me. That is how I got to see the whole experience with how diverse it is, even though it has different schools, how I've been able to be opportune to get access to these different schools, being able to study biology, which is very diverse in its own, and even the fact that we even got to do some general courses and departmental courses, which not only give us a perspective into our majors, but also get to know other fields outside of what we are studying, and that helped us a lot. And the fact that I've been able to even go outside that to get a minor in ICT, which had a whole impact in my life. Currently, I can even say I'm doing more in ICT than biology because of the foundation that we got to have here, how the teachings were constructed, and of course the challenges and despite the challenges. But I see them as things that would prepare us for whatever walks in life we are going for. No matter where we go now, we can make it anywhere.
My journey in the University of The Gambia was beautiful and also challenging. The beautiful memories I had were when I served in the student union, in the medical school. I served as the IPRO, and also in the UTG SU, I served as the vice president of the 16 Executive Council. And honestly, it widened my scope and taught me a lot. There were so many things that I didn't know as a medical student, which helped me, which built me up. So the UTG SU especially built me up to a level that I couldn't even imagine. And the good thing is I got to interact with a lot of people that were in other schools and other departments in the UTG. And so I got to eat from every plate, sort of, while being a medical student as well. And also even in medical school, I had a really beautiful journey as well, because I got to interact with people all over the world. Being in the EFSTH, we had patients coming from all over the regions in the country because it's a main referral center. We had students as well coming from different parts of the country, of the world as well. And we got to interact with them, associate with them. So it just taught me how to talk to people and how to interact with people as well. So it was a pleasant journey.
To what UTG is now, with different campuses everywhere. And also the number of programs and the number of the quality of our programs, the quality of our personnel. In those days, before 2005, you can count even Gambians who were senior lecturers at that time. Before 2005, all the cream right now at UTG. All these leaders at that time, they were not occupying those positions academically, and you can notice that things have changed. And programs-wise, we introduced new programs that are really geared towards changing the trajectory of this country, changing the development agenda of this country. UTG is setting the pace, and that's what you have now. In all sectors, in all offices, wherever you go now, you find UTG leading, and that is the most important thing. And also at different levels, I've noticed now we are offering masters and PhD programs, and in key strategic areas. Imagine now PhD in law, PhD in public administration, public policy, economics, and masters in different areas, like for instance statistics and data science that we are launching now, and the core maths areas.
Quality of the academic staff over the years has improved significantly. And if you compare, thank God I've been here from the 2000 to date, and there has been significant progress in terms of the caliber of staff, that we have in the different faculties. Currently, the number of PhDs, the number of professors have increased, drastically, and we still recruiting more on PhDs, those at the rank of senior lecturer, associate professor, and professor.
The University of The Gambia has always endeavored to have a very student-friendly environment since inception. And recently, a lot of work has been put in place to ensure that the students enjoy their student life at the university. Among them include a well-equipped library, which the University of The Gambia is having discussions with international stakeholders to ensure the digitalization of University of The Gambia library. This actually will go a long way to allow our students to enjoy access to university library from their comfort zones. I think this is a major milestone for the University of The Gambia in recent times. Secondly, there is a need for counseling center, especially for students who really need to be counseled. And this has been taken up, and recently we had collaborated with UNDP, which has supported us, and materials have been supplied for this initiative to kickstart. So shortly, when the initiators conclude on the discussions as to when actually to begin, this is an initiative that is already ready to begin, to start. So in addition, the university students, we had done a lot in the past few months as a result of COVID, again to allow our students to continue with their education, not to have COVID be a cause for a discontinuity in their learning processes. So as such, the university was quickly able to embark on an innovative initiative, that is to introduce the online learning. And with this, we had spent a lot of money to allow each student have access to the internet and have all the classes online, and they have enjoyed this process, as it has also allowed them to interact with their colleagues virtually. This has also to some degree encouraged innovation in academia, especially in higher education in the Gambia.
The School of Medicine and Allied Health Sciences offers a number of courses. There is a Bachelor's in Medicine and Surgery course, which is our basic medical degree. We have recently started a dental program, which is hopefully will contribute to dental services in the country, which are very limited outside of the urban areas. There is a Department of Nursing, which offers both undergraduate and postgraduate courses in nursing. There's a Department of Physiotherapy, which offers a BSc degree in physiotherapy. In addition, there's a Department of Public Health, which is part of us, who are in Brikama, based in Brikama. Now, the Department of Public Health offers both undergraduate bachelor's degree as well as master's degrees in public health, MPH and MSPH degrees. So in addition to all those programs, we also have technicians program that trains physiotherapy, radiology, laboratory, and pharmacy technicians. These are shorter courses that we offer, and we are currently working to getting them accredited. All of these are aimed at actually impacting and improving the quality of health care that is delivered to our peoples. And I do believe that this will positively affect the quality of care. Getting these personnel trained will add to the human resource capacity of the Ministry of Health.
Realize that the Gambia needs, our health system needs a cardiologist or cardiologists around. And it's important because we have our own Gambians going for simple procedures in Dakar when we can do it in the Gambia here. But the only problem is we don't have the expertise and we don't have the equipment as well. So if we have the human resource that we need, we can actually have simple cardiac procedures done in the Gambia, because a lot of Gambians are dying because of simple things relating with heart conditions, children and elders alike. And we believe that, I believe as well, that this can change if we try to specialize.
Every convocation, you have something new. So the first cohort of homegrown PhD holders will be graduating this time. So history is in the making, and UTG is in that process.